Hello, John. My name is Gurleen, and I'm one of the nurses in this ward. I have your case notes with me, and I see that you're scheduled for a colostomy later today. I wanted to check in on you to see if you have any questions, and you seem a little anxious as well. Is there anything that's bothering you?
Yes, nurse, this is the first time that I'm having surgery, and I'm really frightened about this procedure.
Did you say that you're worried about this procedure?
Yeah, I'm scared and worried too.
I'm sorry to hear that, John. Could you tell me what's bothering you? Is there a specific aspect that you're bothered about?
Yes, number one, that I'm having this any kind of surgery for the first time, and second is that I'm really concerned whether I'll be able to return to my normal life after having this procedure.
Okay, it's reasonable to have these concerns, John. Like you mentioned, it's your first surgery, so of course I understand it's a daunting time for you. Let's go over the recovery timeline and the recovery process. I hope that would assuage your concerns.
Yeah, sure.
Lovely. So, John, to begin with, your recovery would take approximately 3 to 10 days in the hospital, following which you will be discharged. But even after that, we'll give you comprehensive support to make sure that the transition is as smooth as possible. Number one, we'll give you education on how to manage the colostomy pouch that you can discreetly manage and it won't interfere with your social life or your normal life or routine in general. Number two, you will be given education on performing some light exercises to build strength.
Mhm.
Uh, Three, you will be given advice on what diet to follow until you have healed completely. And finally, you will need to make sure that you're giving your body enough rest to make sure that you recover optimally. Hmm?
Mhm.
What questions do you have about what I've just talked about?
Yes, I'm really concerned and about this colostomy pouch, and I think it's really going to be embarrassing for me to have this and wear this colostomy pouch all the time.
Hmm.
And you see, I have been leading a very active social life, and I'm
Hmm.
worried about participating all in all the social activities that I've been participating so far.
Of course. See, it's completely normal to feel this way, John. It's completely normal and reasonable to have these concerns. I'd like to reassure you here. Like I said, we'll give you guidance on how you can discreetly manage the colostomy pouch. So please trust me,
Mhm.
it will not interfere with your social activities. You will be able to resume your social and routine activities as you had been engaging in prior to the surgery. So please be assured in that regard. Moreover, we'll also give you support by the local GP and the district nurses to make sure that you're well adjusted to your normal life. How do you feel about
Mhm.
this?
Yeah, that's good. That's great news. And so, could you please outline the management plan to support me after this
Yes.
surgery?
I'd be happy to do that. So we'll obviously begin with taking care of you in the hospital. We have a dedicated team of nurses and doctors here who will give you specialized support and comprehensive care while you're here. We'll oversee your recovery. Once we feel that you are able to take care of yourself, and at least be discharged home so that you have the ability to self care, we will then give you very specific guidance on how to look after yourself at home before the discharge. In fact, what I would suggest is that you meet with a stoma care nurse who basically will give you specialized advice on how to care for yourself at home, independently manage, and of course, provide you any support that you need. Okay, so she'll be able to assess your situation and outline, customize a tailored management plan for you. What would you be willing to
Oh,
do that?
yeah, sure, surely.
That sounds great. The stoma nurse also might introduce you to some stoma support groups. She will encourage your participation in it. I think the best way
Mhm.
to get through something difficult is through shared experiences, and I think this would be very beneficial for you once you have been discharged. How does this sound?
Yeah, that sounds great. Surely I'll join the stoma support group.
Great, great. So let's get you prepped for the surgery. And following that,
Yeah.
I and the doctor will come to check in on you. And of course, we'll ask the stoma nurse to visit you tomorrow.
Okay. Thank you.